Assalamu alaikum, my name is Tarana. Our research focused on Christian rat sarcoma G12C mutations in non-small cell lung cancer. So we really wanted to learn about the HER protein family as that reactivates cancer signals. And inshallah, we wanted to be able to improve treatment outcomes for patients through novel combination therapies.
Assalamu alaikum. My name is Maudud Rana. So essentially the main findings of our research was that when you inhibit the initial mutation, which is a KRAS G12C mutation, the cancer finds an escape route through phosphorylating the HER family of proteins. And so in that case, you need what's called a pan-HER TKI or tyrosine kinase inhibitor. So in the graph to the right, the purple line shows our combination therapy leading to the best treatment outcomes for tumors in murine models.
Assalamu alaikum warahmatullah. My name is Daniel Ahmed. So the key to overcoming therapeutic resistance is the combination of these drugs. With future trials, patient response rates can improve by 40%. Inshallah, all three of us wish to become physicians and perform work for RZ one day. Jazakumullah.
Jazakallah. Our next speaker is Abdus Samia Masai.
Assalamu alaikum. I'm Sani Ahmed, a BS candidate in Business and Neuroscience at NYU, and Richmond and Hampton Roads Humanity First Ambassador. My research at CUNY Graduate Center uses a neuron simulation platform to model synaptic mechanisms underlying motor learning in the primary motor cortex. I've reproduced both spike timing-dependent plasticity and reward-driven synaptic adaptations that closely mirror empirical motor learning behaviors, as you can see from the shift from pre-learning to post-learning weights. These results confirm cortical reorganization during motor tasks and lay the groundwork for next-gen rehabilitation and BCIs, which leverages M1 dynamics, which underpins the GAN cloud theory of the brain as GANs, or generative adversarial networks, encoding dreams and memories for biological cloud storage. As an NYU presidential scholar and first author in Springer Neuroscience and Elio Journal, I'm committed to a career as a physician scientist driving industry-grade neuroscience innovations. Jazakallah.
Jazakallah. Our next speaker is Umar Chaudhry Saib. I'm sorry. Our next speaker is Talha Ahmad Saib. Sorry.
Assalamu alaikum. My name is Talha Ahmad. I am a second year at Rowan Virtuoso School of Osteopathic Medicine, and I'm an aspiring oncologist. So within the cytoplasm of a cell, we have proteins, nucleic acids, and various other molecules that could condense and decondense depending on the cellular environment. The goal in our lab is to mimic these biocondensates with a combination of zinc chloride, ethanol, as well as various other dipeptides, as can be seen on the screen. The hope of this research is to create a more targeted drug delivery system where these biocondensates will deliver therapies specifically to diseased tissues while avoiding normal tissue, subsiding deleterious side effects. Jazakallah.
Jazakallah. Our next speaker is Talha Ahmad Saib, also DO candidate. I'm sorry, not enough coffee today. Okay, Umar Chaudhry Saib, sorry, MD candidate.
Assalamu alaikum warahmatullah. My name is Umar Chaudhry, and I'm serving as Secretary Khidmat al-Khalq in Majlis Atfal Ahmadiyya. I'm a first-year medical student at Rush Medical College in Chicago. So I did a study with Ali Malisab here on the outcome of using mechanical ventilation in the cardiac ICU. And we had the opportunity to do a registry-based cohort study at Michigan Medicine. And we found that registry-based studies aggregate a lot of data on patient populations with rare clinical profiles across many hospitals and systems. And inshallah, I hope to get more involved in this research in the future.
Jazakallah. And now we'll move to Ali Mali Saib.
My name is Ali Abdullah Mali, and I'm a third-year dental student. So the study evaluated morbidity and mortality comparing ventilated patients to non-ventilated patients in the cardiac intensive care unit. Patients requiring ventilation in the cardiac intensive care unit were found to have higher mortality, longer hospital stays, and greater reliance on advanced therapies like vasopressors and mechanical circulatory support. So the impact would be that initiating mechanical ventilation in the cardiac ICU should prompt earlier discussions regarding the prognosis of the patients.
Jazakallah. Our next speaker is Khalid Hossain Saib.
Assalamu alaikum. My name is Khalid Hussain. I'm a recent college graduate applying for medical school and working full-time at Johns Hopkins on 2 projects for early pancreatic cancer detection and treatment. Firstly, I'm working on endoscopic ultrasound for pancreas, which is notoriously challenging to interpret and map. We screen high-risk patients identified through family history and genetic sequencing and place them on regular EUS schedules, endoscopic ultrasound. For EUS procedures, we're developing an AI segmentation algorithm to map pancreatic anatomy in real time and generate heat maps that highlight regions of interest for biopsy, targeting the most suspicious areas with precision. These biopsy tissues then feed into our AI-powered pathology pipeline where deep learning segments cell nuclei and analyzes their morphology, their shape, and their features and all of that. Leveraging our large image data set and extensive patient follow-up, we aim to power prognostic prediction and specialized treatment planning from nuclear features. Together, this creates a closed loop, screening the right patients, targeting the right tissue, and tailoring the right treatment to detect earlier, treat smarter, and improve survival. Jazakallah.
Jazakallah. Our next speaker is Muzaffar Ibrahim Saib.
Assalamu alaikum. My name is Muzaffar Ibrahim. I'm serving as Nazim Mal for Boston Jamaat. I'm also a PhD candidate at the UMass Lowell in Boston. My research is focused on the study of electromagnetic radiations transitions in fluorine-22. So fundamentally, there are 4 forces of nature. We have the electromagnetic force, which is the force that exists between charges. We have the gravitational force that exists between mass bodies or matter. Then we have the nuclear strong force and the nuclear weak force. The nuclear weak force happens when we have beta decay. You have a neutron changing into a proton with the emission of an electron. So Dr. Abdus Salam's work was unifying the weak force with the electromagnetic force. But what is still a mystery, as the Holy Quran indicates in Quran chapter 3, verse 190, it says that in the creation of the heavens and earth, and in the alternation of day and night, there are indeed 4 signs of man of understanding. So what we still don't understand and we are wondering about is the nuclear strong force. We do not have a constructive nature of the nuclear strong force. So my study of studying fluorine-22, which has a half-life of 4.23 seconds, which is in a region that is supposed to show positive parity. If you look at the graph beneath, the top one is the even parity, meaning that it's symmetric. And when I say odd parity, it's anti-symmetric. So fluorine-22 is found in a region where it's supposed to behave symmetrically, but FSU interaction theoretical prediction is saying that they are observing negative parity for fluorine-22, which means that it's going to alter the shell model calculations, which predict on the figure top there, that should be the standard ordering. So this study would modify and improve shell model calculation and enhance our understanding of the nuclear strong force. Jazakallah.
Our next speaker is Dr. Qamar Khan Sahib.
Assalamu alaikum warahmatullah. My name is Qamar Khan. I'm currently serving as a Tabligh secretary in central New Jersey, where I'm also practicing as an academic hospitalist. So this is a case of a 21-year-old male who presented to the hospital with classic symptoms of meningitis, including headache, confusion, and fever. Necessary tests were done, which were all negative. After inquiring from patient further history, he informed us that he had a recent urinary tract infection for which he was prescribed a medication called Bactrim. This is a common medication that is given for a urinary tract infection. This medication was held, symptoms resolved the following day. Given the rapid resolution of patient's symptoms following cessation of Bactrim and lack of evidence of other causes of meningitis, the patient was diagnosed with aseptic meningitis due to Bactrim. He was strongly advised to avoid this drug in the future as repeated episodes of meningitis are possible. Bactrim is actually the most common antibiotic to cause meningitis. Hence, it is important for healthcare professionals to be aware of the side effects so these medications can be discontinued in a timely manner and to avoid unnecessary testing. Come learn about how over-the-counter medications can cause meningitis. Jazakallah.